Let me check my own time. Good morning. Welcome. I very quickly will speak about cognitive behavioral therapy of high functioning autism. Uh, my slides. Actually, especially it's a condition that cannot be really properly diagnosed, different diagnoses put, and with medical therapy, may not be sufficient, especially with the adolescents that I first started to work with. Looking at the childhood period, some of them already diagnosed among my, again, clients, and the others, again, cannot be put for any diagnosis. They have high IQ, and if their success is also good, these are the things that were not that much considered. But during adolescence and adulthood, of course, there starts the onset of signs and symptoms. The clinical presentation of the condition already discussed. Now, it is mostly the cognitive behavioral therapy, CBT, that really worked so well for these patients. More pragmatic, and especially there is a training component and education component of CBT. That's the reason why it's actually much more meeting the actual demands of these clients. If we apply it to high functioning autism for HFA, biologically, it's actually a component of being not so resilient. You know, we all have some beliefs about ourselves, about the others, and it is then especially it affects the way that we assess the new events. During the childhood, if there is a certain bias, what do I mean by this? If we feel that we're not strong, and if we believe we're not being cared for, respected, or loved, during childhood, then we can actually come across with more challenges in our adult life and, of course, from clinical perspective. Therefore, HFA is actually a sign of not being so resilient. Of course, all these attitudes result in some negative implications with friends, with parents, and individuals with such negative patterns in any time of their life, if they come across with something not so pleasant, then that's the onset of the clinical conditions. That is in general, the cognitive behavioral model. For example, graduating from school but still unemployed, and feeling that I'm useless, I'm a failure in life. It's all not being hopeful, and I'm not actually an adequate person. I have to be successful all the time. I have to be perfect in everything that I'm doing. So they start developing certain strategies. Of course, due to this unhappiness and lack of hope, there is actually automatic thoughts, this part that is immediately popping up in the mind. Well, at that time, what is in the mind of the individual is, so I fail, I'm a loser, but this part in particular is what we call different patterns. It is actually the implicit beliefs, our way of thinking in terms of ourselves. Because of the lack of hope and unhappiness, the person is actually staying home. Of course, it is quite likely that they cannot find a job. We first make an assessment in therapy. The first session is mostly psychoeducation. It's a simple formulation. And then my method is to have some cognitive interventions and then move to the behavioral interventions. And at the same time, depending on the specific problem of the individual, either cognitive or behavioral, whatever the intervention is, we start to have a recovery. It is most of the secondary problems that they actually come up with. But the cognitive mechanisms, like lack of theory of mind, is the commonality. Just as a simple example, a very successful, a very smart, a very well educated, for example, individual, and brought to the therapy by the spouse, a very well trained one. During a dinner, flowers on the table in a vase, and get one flower from the vase and give the flower to another woman at the next table, and you are so beautiful. But the spouse, of course, the wife, is actually so angry about this. And just as we have observed in the previous presentation, and cannot understand why uh, his wife is mad at him. Even if it is obsessive compulsive disorder, depression, or any relation problem, this is a commonality. Of course, there could be some problem solving issues for life problems. In the assessment, first we try to understand the history of the problem. And if possible, for example, from the parents, it would be very useful to get some information. And also the enemies of the individual and the life story. First, try to understand, identify the life problems. If there is nothing, for example, specific, saying that I lack hope, why? I'm not happy, why? How would you feel better? And what would you do if you're happy? You have to actually make it much more substantial. The problem list must be kept short initially. If it is too complicated, too long, it actually would make the client feel worse. First, it must be lean and simple. And then it is much better to get into details while going through the short list. For example, if you identify a problem list of 30 at the very beginning, would also create a lack of hope. Psycho education. This is the first and the second session of the therapy, if possible with the parents, but we also make it so simple. We present it in a brief, concise manner. As you all know, we in our emotional and psychological reactions, it's all about the environment we live in, what we take from the environment, what we give, about the physiological reactions, our behaviors. All five of those together create a psychological problem. And psychotherapy is actually something new, a new component to the life of the individual. Again, to the behavior. If we give any medical therapy, then it is mostly physiology, emotions, and the body that will be affected. Of course, by saying that, our goal is actually to find a solution to the problem. This is actually I use carbon copy, and I always give one copy of the paper to the client. It's important to have such notes. There is a general outline of each session. We first start with an assessment. I don't know if you can see anything in here, but the very first five is like an introduction. What happened during the week? Just a brief assessment. And then we identify the topic that we'll be working on. It could be, for example, a specific problem experienced during the week. And that's what we work on. It's mostly actually something connected to the underlying cause. And then put it on the table as an agenda item. And then the task, home assignment. Debriefing is important. And having a structured approach is good for these individuals, and they also enjoy having such structured approach. So we're not suffering from any trouble in here. Sometimes, due to motivational and cognitive deficiencies, it could be 45 plus minus 5. I mean, 45 to 50 minutes of a session can be long, so you can have so shorter sessions depending on the day. Rather than long talk, it's possible to be more concise, more, again, tangible talk as a therapist. And as I told you, taking down notes during the therapy is important and sharing it with the client. From time to time, if, for example, they are not objecting, you can make the recording of the session and ask the client to listen to it. Of course, when compared to the other groups, I guess emotion training is something that we should work more on. You know, in general, during therapy, during psychoeducation, this is what we're doing, but especially emotional reactions, behaviors, they have difficulty in understanding emotional reactions of the others, so it's important. Especially nonverbal components of the emotional expression cannot be understood by them, and this can actually lead to paranoia. Why? They live in a certain condition, and there is actually a certain emotional reaction. They thought that it's not something to do with them, but they actually refer it to the others. That's the reason why they can have some paranoid thinking, uh, cannot understand the intentions of the others. And just like the previous example, cannot understand why it is wrong to do anything like this, like the flower example. Those with the Asperger syndrome sometimes can express themselves inappropriately, or even a minor topic, for example, they can be suicidal, over reaction, exaggeration, use of alcohol, excessive alcohol during times of depression. Especially in children, it's good to use the methods that we use with children. Those who are, for example, thinking tangibly, or those therapists who are working with personality disorder, and there is it's about a book for how to grow up a child for the parents. I believe that the clinicians at the same time should read the book. Why? Because cognitively, in the personality disorder, the way that processes emotions is just like the 2 to 6 years of age of a child. How to intervene, how to cope with this. So it could actually provide us with some good cues. Again, for expression of emotions, alternative methods can be used. Again, for children, it's a children's book, but still, it's a book, again, about emotions. A French author also has other books. Uh, Even there are, for example, photos, images, and you can easily use it. Let's assume fear. Fear is like an alarm system. Cognitive techniques. The main goal in here is to understand and to change the cognitive structure that results in some emotional reactions and turn it into something positive. In a way, just like wearing an eyeglass. Normally, for example, the clients, they have their own reactions, but they connect everything to the incident on the table. But we know that there is actually, they have their own way of interpretation. That's what we're telling them. Of course, in saying this, it is not a Socratic method, and by making sure that the client actually reveals it. In general, if there is an emotional and behavioral reaction which is negative, which affects a reaction negatively for the individual, then again there are some inappropriate, not useful assessment underneath. In particular, in depression and anxiety disorders, we can observe this. In Asperger patients, normally, in non-autistic individuals, when you have a look at a certain mind content, is there are some emotions and thoughts, for example, four of the experiences, but in individuals with AS, it could be less. They may not verbally express themselves, or visually, for example, they can express themselves, so we have to pay attention to this. Visual images, in particular, it can affect the individual more. Some cognitive restructuring techniques. What is emotion? What it is for? And what you want and what you do not want. It's actually a signaling system. About thought is something in your mind, or the images are the things that are completed in your mind. Then the role of thinking is to actually identify, to name things, or to predict what will happen. And therefore, to direct our desires, then to what extent your thought is realistic, to what extent it is appropriate and adoptable, and finally, how this thinking will affect them, whether it's something positive or negative. It doesn't have to be in this order, not like the first, second, third. It can actually change. Let's assume, for example, the evidence examination. There are indications. How do you make sure? An alternative explanation. For example, your friend laughed at you, but maybe there's another reason. Or is there, for example, any who would be happy to see a friend laughing? How would they think? So I can say all techniques of CBT can well be used also for these clients to correct the, again, faults in thinking. Some social stories, comics can be used. And for example, the toxic thoughts can be considered as useful ones. In the past, we used this at certain parts of the story. It's given to the reader. For example, it has a different ending depending on what they will be doing. Also used in the children's therapy as well. Again, the social anxiety. Normally, for example, reading a text and did you experience any problem? And let's assume someone put a again gun in the hat and saying you have to perfectly read this. If you make an error in reading this, then we'll pull the trigger. How you will be reading it aloud. Another, an OCD, again client. I mean, Asperger, adolescent with OCD. I've used it. OCD is actually like maybe a monster and an animal. For example, you're dirty. You can never sleep. You will not be feeling comfortable if I say if I feel dirty. You should not feed the monster if you want to get rid of it. It is mostly compulsion and avoidance. You see the square and the triangle. If you keep feeding the monster, it will continue to chase you. To make it concrete, in social anxiety or in those success oriented, let's assume at the office, in between these two lines, will we walk 40 centimeters walking? Do you have any trouble? No. The very same thing in between the two skyscrapers if you do it. Again, 40 centimeters on the right and the left side, actually, there's no handle. Then this will be anxiety. I'll be fearful. I would not like to do it walking on the roof of a skyscraper. That's how in exam anxiety. I make it as concrete. It's not a matter of life and death. But if we consider anything as a life and death situation, then this actually can end up with anxiety. Just like this, that's actually something. These are papers, by the way, on the carpet. You can use it in your office as well. Behavioral techniques is mostly for avoidance and safety behaviors. And again, for the OCD, most compulsive component, I mean target-oriented, it is mostly the process that we focus on, not the ultimate goal. Passing the exam, being successful, being top, having a top grade, rather than this, focusing on the process, that is getting ready and for the test, for example. Of course, there's a metaphor, and we work on each metaphor for long. If depression, just like a carriage, for example, the horses are pulling the carriage, and normally a healthy individual, for example, we actually have some desires. We do it, we enjoy it, and we wanted to do it again. In case of depression, there's actually a lack of this, and you cannot actually start an action. And unhappiness, it is just like no horse in front of the carriage. If you put the carriage in the front and the horse at the back, it will not move. A depressive individual, for example, if waiting for that arousal to have any feeling or any desire, then of course it would be problematic. Problem solving is important because in individuals, the most important thing is the social skills. And in terms of the social skills, as they actually have some problem, they actually have more challenges. And that's the reason why we have to be working on the social skills and avoidance. In avoidance, in the short run, it's comfortable for the client, but in the long term, it is something detrimental. That's what we focus on. It's actually not mostly avoidance, but just postponing. And what is actually, for example, flight behavior, or A is actually running away from B. Just like myself, for example, if I'm on the stage, I probably will actually start running to the door. What the clients are doing, they are not actually running away. It's not a flight behavior. Whatever they want is actually in front of them like a barrier, and it is getting bigger and bigger. So rather than flight behavior, what is important is actually to find some alternative solutions. Just very briefly, I can say it is mostly due to visual thinking. It's very important to use written and visual material as much as possible, just like the children's therapy. By the way, in adult therapy at the same time, it's very useful to use so many visual materials. Even, for example, a simple drawing on paper would help for imagery. It can actually be a life knowledge, just like the metaphors, for example, use of metaphors. At the same time, engaging them in the story. If it was you, what would you do? And so on. So turn it into a life knowledge. And another thing is the emotional training must be highlighted to the extent possible when compared to standard CBT. And you have to actually avoid using actually uh, tangible things. I mean, rather than using abstract terms. I mean, they may not understand abstract thinking or abstract way of expression. Of course, as you all know, CBT is actually directing. Therefore, in these types of clients, to the extent possible, it's very useful when compared to other forms of psychotherapy. And for generalizing the skills with the spouse or with a family member, it would be nice to work together and collaborate. So, thank you for your attention.